miracle cure that you hear about on the news. That's you don't hear about everyone who's dying. You hear about that one person who's had the miracle cure, or for whatever reason, they turned around when they were supposed to. They're living 5 years and they were supposed to have been dead in 2 months.
Well, and even we were saying before, DNR, do not resuscitate the other DNR. So at end of life, it's really appropriate for people who have a terminal illness to sign this waiver that says, do not resuscitate me. I don't want CPR when I die. A lot of people will not sign that. They want CPR. They want everything that can be done for them. But it's because media portrays that you're going to get CPR, you're going to be okay. What the reality is, 4% of people who get CPR actually will survive if they have a terminal illness. And if you are going to get CPR, even if you do survive, or if you don't survive, you're going to have broken ribs. You're going to have a lot of pain. It's going to be really traumatic to your family to see this, especially if you still die. So this huge media impact upon what's happening here. But here's the thing that I find most interesting to me. So we see that hospice and palliative care definitely have these lower cumulative impacts overall. We don't want to go into hospice because we're afraid of dying. But if we went in there, if we transfer in, when we have the time, if we transfer in there 6 months before we actually die, a lot of things happen. We would prefer to not die in the hospital. Hospice allows us to die not in the hospital. We have better pain and symptom management if we're in hospice because the physicians are trained to use narcotics more effectively. A lot of physicians in the conventional setting are afraid to use